Hello, my name is Perkins, and I'm currently a first-year medical student at the OSU College of Osteopathic Medicine at Cherokee Nation. My colleagues and I have put together a cross-sectional analysis over behavioral risk factor surveillance systems from 2017 to 2020 in regards to disparities in seasonal flu vaccine uptake among Spanish and English-speaking Hispanic Americans. Today, I will take you through these findings. Research has shown that vaccination for seasonal influenza is associated with a near third reduction in flu-related mortality and a quarter reduction in likelihood of ICU admission. From 2009 to 2019, Hispanic residents of the United States had the third highest rate of flu-related hospitalizations, with more severe outcomes, including intensive care and mortality, than non-Hispanic whites. Language barriers may have negative implications on the health of patients, as well as those embedded within those patients' network. Not only does the language barrier limit discourse between patients and providers, but it has also been shown to lead to a decrease in care. The purpose of the study is to analyze behavioral risk factor surveillance systems, BRFIS data for short, in order to compare rates between Spanish and English-speaking Hispanics aged 18 to 64 years old and among those 65 and older from 2017 to 2020, with a secondary objective to investigate trends among age groups by sex. We began by extracting data from the behavioral risk factor surveillance system from 2017 to 2020. Respondents were included if they identified as being Hispanic and responding to a question regarding flu vaccination, either via shot or nasal spray. Other variables extracted include the language of survey used to identify Spanish and English-speaking participants, age, 18 through 64 and 65 plus, and sex. We then estimated the prevalence of flu vaccination among easy BRFIS cycle overall and among each subgroup, language, sex, and age groups, and used chi-square tests of independence to determine associations among groupings. Our data revealed that each year, the 65 and older age group had higher rates of flu vaccine uptake compared to the 18 through 64 age group. In the 18 through 64 age group, English-speaking men were about 3 to 7% more likely than Spanish-speaking men to get vaccinated across the board. Spanish-speaking women aged 18 through 64 were 4% more likely to get vaccinated than their English-speaking counterparts in the year 2018, but they had lower vaccination rates in other years. In the age group population of 65 plus women, Spanish-speaking women were almost 8.5% more likely to have been vaccinated than English-speaking women in 2018. Language barrier can be a routine challenge facing healthcare workers in locations of diversity, and this barrier may even perpetuate the decline in empathy expressed by healthcare providers. A study by Pearson et al. Found that Spanish-speaking Hispanics aged 65 or older were significantly less likely to have received the influenza vaccine compared to English-speaking Hispanics from 2005 through 2007. However, our study reveals that this trend changed in 2018 when more Spanish-speaking women received vaccination than the English-speaking women aged 65 plus. These findings may indicate an improvement in quality of care for Spanish-speaking women or possibly a cultural change leading to vaccine uptake promotion. Since English-speaking men and women aged 18 through 64 were more likely to get vaccinated, it is reasonable to conclude speaking predominantly English contributed to the increased vaccination rates. Due to the fact that Spanish-speaking men express more of a disparity in vaccination rates compared to Spanish-speaking women, we concluded this finding may be due to cultural factors such as male gender roles within the Hispanic culture. Each year, there are nearly 1 billion cases of influenza globally, and between 260 to 650,000 influenza-associated respiratory deaths. In the United States, from 1999 to 2019, influenza and pneumonia infection has been the 9th leading cause of death, and there is an estimated annual burden of $11.2 billion on the United States healthcare system. Influenza continues to be one of the most significant preventable causes of illness in the United States, and increasing vaccination rates will help alleviate the burden on the healthcare system, as well as save countless amounts of lives. Thank you guys for your time today. If you have any questions, please feel free to contact me or Angel. Thank you. Have a nice day.